This is a difficult condition to diagnose, especially in new mothers. It is therefore preferable to carry out prenatal checks and inform the doctor at the slightest symptom. Cervical insufficiency is also known as cervical insufficiency. It occurs when the cervix dilates too early during pregnancy, usually without other symptoms. This then leads to premature delivery or miscarriage. Normally, the cervix dilates only when labor begins, in response to contractions. In cervical insufficiency, this dilation occurs during the second trimester of pregnancy, without pain or contractions. This anomaly can only be detected when a woman is pregnant. Otherwise, her uterus is functioning normally. If a woman has suffered from cervical insufficiency in subsequent pregnancies, it is highly likely that the same will be true of future pregnancies. Common symptoms of cervical insufficiency. Cervical insufficiency does not cause any symptoms in early pregnancy. Only a few women experience light bleeding during weeks 14 to 20 of gestation. This bleeding can last a few days or several weeks. In addition, some women experience discomfort during the second trimester of pregnancy, such as changes in vaginal discharge, sensation of pressure in the pelvis, pain in the back manifested by a strange sensation, mild abdominal cramps. What are the causes? Science has failed to establish a specific cause of cervical insufficiency. However, certain factors have been identified that increase the risk of suffering from this anomaly. The most important are multiple pregnancy. Cervical insufficiency occurs more often in women who have several babies at the same time, have suffered a tear in the cervix during a previous childbirth. LEAP background. This is an electrosurgical excision procedure performed to prevent cancer of the uterus. Congenital connective tissue disorder. This includes various abnormalities in the uterus that present at birth. This is the case with Ehlers-Danlos syndrome. Congenital malformations of the uterus. They are present at birth. Injury or trauma in the cervix. Exposure to diethylstilbestrol. It is a hormonal drug. If a woman's mother took this medicine during her pregnancy, it increases the risk of developing cervical insufficiency. Women who have suffered from miscarriages, especially when they occur before the 4th month, are more likely to have cervical insufficiency. Diagnosis of cervical insufficiency. The diagnosis of cervical insufficiency is difficult, especially when it comes to the first pregnancy. If the healthcare professional suspects this abnormality, tests and examinations will be necessary to confirm the suspicions. The most common diagnostic tests are transvaginal ultrasound. This test measures the length of the cervix and determines if there are any membranes protruding from the cervix. If the cervix is less than 25 mm, this confirms cervical insufficiency. Pelvic examination. This is a visual and manual check to see if the amniotic sac and fetal membranes are in place or not. Laboratory tests. They are carried out in case of suspicion of infection. To determine this, a sample of amniotic fluid is taken and analyzed under a microscope. Cervical insufficiency. Available treatments. Once the diagnosis has been confirmed, there are treatments available to prevent serious consequences. The goal of all these measures is to delay childbirth as long as possible. Progesterone supplementation. A study conducted by several medical centers and universities in the Netherlands reports that progesterone supplementation reduces the risk of premature birth and miscarriage when a woman suffers from cervical insufficiency. Progesterone is given as an injection or as a vaginal suppository. Cervical cerclage. Cervical cerclage is a surgical procedure that involves closing the cervix with strong sutures. This cerclage is then removed between weeks 36 and 38 when it is possible to give birth safely. Indeed, week 37 is considered the end of pregnancy. Sometimes the stitches are removed during childbirth. Arabin pessary. Here is another procedure in which the cervix is wrapped and closed in a ring specially designed for this. In this case, no surgical intervention is necessary. This technique is considered to be very effective when the mother has a V-shaped cervix. However, research on this is still lacking. Bed rest. Bed rest, or pelvic rest, has been shown to be an effective method of delaying childbirth. It can be partial or total. In some cases, the expectant mother can only get up to eat and go to the toilet. Even though this is genuinely uncomfortable, it is a simple and proven method. Risk factors and complications of cervical insufficiency. The most obvious risk factor in this case is neck trauma. In case of injury or surgery in the area, it increases the possibility of suffering from cervical insufficiency. As stated above, other risk factors include congenital problems, connective tissue diseases as well as exposure to the drug diethylstilbestrol. However, many of these women do not have any of these known risk factors. African American women have been shown to be at increased risk. Regarding the complications, the most obvious and most serious are premature birth, or the possibility of miscarriage. Regular screening is essential. There is no way to know if a woman has cervical insufficiency unless she is pregnant. This therefore creates a major difficulty for the diagnosis and early treatment of this anomaly. Therefore, it is best to maintain continuous and effective prenatal